Good afternoon, everyone, and welcome to this afternoon's webinar responding to the Ageing Workforce Challenge. I'm Stephanie from WorkSafe Tasmania and also the coordinator of WorkSafe Tasmania Month. I'll be your moderator for this afternoon's session. Before we do get started, I'd appreciate you taking a few moments to read the following slide about information delivered during WorkSafe Month sessions. So how to interact. We've taken a screenshot of an example of the attendee interface. You should see something that looks like this on your computer screen in the upper right corner. You're likely listening in using your computer's speaker system by default. However, if you prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. You have the opportunity to submit text questions to today's presenters by typing in your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect them and address questions during the presentation and also at the end of today's webinar. We are recording webinars during WorkSafe Tasmania Month and will progressively make them available on the WorkSafe Tasmania website. Also, before you do leave today's webinar, you will receive a survey on the presentation and we'd appreciate it if you would complete the feedback at the end of the webinar and provide us with your comments on your webinar experience and also on this afternoon's presentation. I would now like to introduce this afternoon's presenters, both from IPM Safety. We have Kirby Dillon and also we have Ruth Sullivan. Please make them welcome, so both welcome Kirby and Ruth to present this afternoon's webinar, Responding to the Ageing Workforce Challenge. Welcome.
Excellent, thanks Stephanie. I'm Kirby Dillon and I currently work with IPM Safety as an injury management and ergonomic consultant. My background is as an exercise physiologist. So prior to working with IPM, I worked in more of a clinical role. So I worked with a range of patients who had various injuries and medical conditions, and I'd work with them to design an exercise program which focused on increasing their strength and function and getting them back to normal aspects of their life. I still do some work in the injury management field, but I also spend much more time looking at preventative strategies now, and in particular those relating to ergonomics and manual handling and health and wellbeing in the workplace.
Hello, I'm Ruth and I joined IPM and also in January of this year and also work as an injury management and ergonomic consultant. I've completed undergraduate and postgraduate studies in health science, and prior to working with IPM Safety I lived and worked both overseas and interstate, most recently in New South Wales. I've worked largely in the clinical environment and private practice and providing clients with assistance and recovery post-injury with injury prevention and also health management strategies. So my current role with IPM incorporates these skills, but now there's a lot of focus on the actual safety and workplace safety and injury prevention. And I also do some rehabilitation assistance and injury management.
Great, and just a little bit about IPM Safety. We are a Tasmanian owned and operated work health and safety consultancy company, and we provide general work health and safety training, occupational hygiene services, injury management solutions, and also ergonomic and manual handling training and advice. Just a little note on the information that we are providing today. The intention is to provide you with some generic information and a discussion of some of the issues that you need to take into consideration in managing an ageing workforce, and it isn't intended as specific legal advice or health management advice. So we've incorporated some stats and a little bit of information around the ageing population and how that impacts both Australia and Tasmania. So we are very aware that the Australian workforce is ageing and over the next 4 decades the number of Australians over 65 will almost double and we expect to see 85% of the labour market will be over 45 years old within the next 7 years. So these are really high statistics that we're seeing. Also, the proportion of the population participating in the workforce is projected to reduce as well. When we looked at the percentage of the population engaging in paid work between 2003 and 2004, it was at 63.5%, and by 2044 to 2045, we're expecting this to decrease to 56.3%. And when we look at workers involved in employment, they all seek recognition and to be valued. And regardless of age, our employees generally look for the same things from their jobs. Some of these are relating to being recognised and valued for individual skills within the workplace. People also generally seek a connection with the company values and culture as well. People seek support from their direct manager and also the opportunity to learn new things. And then there's also that social aspect and the contact that we have from professional working relationships within an organisation as well. And so when we look at an ageing workforce, there are people may have concerns around how to manage an ageing workforce, but there are some really clear benefits of having an ageing workforce or a mature workforce within an organisation as well, and we really wanted to take the time to highlight some of these benefits today as well. So adapting to an ageing workforce to maximise the benefits of older employees, it can assist us in providing increased stability within an organisation. Older employees on average stay in a role for 2.5 times longer than younger employees, and some of the benefits associated with this include a lower turnover rate, which results in decreased recruitment costs, and also easier planning for the future of the organisation as well. Mentorship and the skills and expertise that we can rely upon from a mature workforce. Some of those directly are the retention of corporate knowledge within an organisation and how we can use employees that are mature to mentor new employees that enable them to pass on skills and knowledge which contribute to the retention of corporate knowledge within an organisation as well. And then the third point was looking at reliability and expertise. Typically we see better attendance records with a mature workforce than younger workers, and we know that this can assist to higher levels of productivity within an organisation. And also the experience and skills that they have in problem solving, and that can contribute to the improvement of an organisation and looking at other general improvement strategies and initiatives as well. Also from a customer service point of view, depending on the industry that you're working within, having a combination of really great corporate knowledge and expertise and work and life experience that can be a real positive when we're dealing with individuals in a customer service aspect as well. So we've incorporated a number of attendee polls today to make the webinar as interactive as we can. So the first question that we would like to put out is, as an employee, how beneficial for you is it to have employees who are able to assist with improving the company's performance in the long term, also have low absenteeism rates, looking at employees who are flexible and able to perform a variety of tasks, and also have a high retention rate. So the scoring that we'll look at is if this is not at all beneficial, that results in a score of 1. For a score of 2, it may be slightly beneficial. For a score of 3, looking at what's moderately beneficial. Number 4 is highly beneficial, and then 5 relates to extremely beneficial for your organisation. So if you can please pop your score into the question panel and just take a couple of moments to do so, and we'll let Stephanie to collate the results for us.
Okay, we'll give it a few more moments. Okay, I guess in terms of the responses that have come through, the majority of people have indicated that 4 highly beneficial and 5 extremely beneficial are important, and in some cases moderately beneficial.
Okay, excellent. Thanks, Stephanie. So we can see that there are some positives in having that mature workforce, and a little bit that we'll talk about today is how we can really tap into that and use that as well. And so the next slide, it really just sums up some of those benefits as well. So it's not just inevitable that older workers are employed and retained, but we know that there are some studies that have shown that people over the age of 45, they do stay longer in their jobs, contribute to the long-term performance of a company, have low levels of absenteeism, and are also flexible in their working hours and conditions. And we're really wanting to work with organisations to look at how we can maximise some of those benefits. And then so just looking at Tasmania's ageing workforce, the median age in Tasmania is 40, and the World Health Organisation uses 45 years of age as the division between younger and older population, and this is also used by WorkSafe Tasmania as the general division as well. And we know that the Australian trend is being reflected in Tasmania with an increasing percentage of the workforce being over 45 years old. And when we look at some of these numbers that we've got in 2002, 34% of the Tasmanian working population was over 45, and in just 10 years by 2012 this had increased to 43%. And when we also look at the age bracket of those aged 15 to 45, that's remained fairly constant throughout that period of time as well. Okay, so I'm just going to hand over to Ruth now.
So looking at some of the employer's responsibilities, an overarching responsibility as an employer is to ensure that providing a safe and healthy workplace for all, regardless of age and fitness. And this covers not just employees, but also any visitors or customers attending the worksite. It is recommended that an employer maintains a performance management system that's fair to all employees, again regardless of age, and by using even numbers and even measures across the workforce. Positive discrimination by making exceptions for the older worker isn't normally recommended. What is appropriate is to ensure that regardless of age, all employees are suited to their respective job. Some of the ways of ensuring that appropriateness is by making sure that all employees can perform any manual handling tasks that they may be required to do safely, and where possible adapting any duties through the use of machinery and equipment by reducing reducing manual labour where possible, so that those jobs can be performed safely. Another way is by cross-training staff. An employer, by assisting all employees to cross-train, can then provide employees with a variety of jobs, a variety of tasks within their role. So that just enables employees to have more of a chance of performing all their duties safely, because they've got that option and variety there available to them. So now just going through, sorry I hadn't stepped through those options there. And looking at age discrimination, age discrimination is against the law in most areas of public life, and this includes things across the board, including education, access to services, renting or buying a house, and then employment. However, there are some limited exceptions in relation to employment, where an employer may be allowed in exceptional circumstances to discriminate against an older or younger person if they're not able to perform an inherent requirement of their role. So an employer must, however, take reasonable measures to assist employees to complete their tasks. So an example may be an employer must provide training, if that training is available, to assist and enable an employee to complete a task to the appropriate standard. So if somebody was allowed to go because they weren't able to perform an inherent requirement of their role when training had been available, then that would be considered as discriminatory. So every measure needs to be taken by an employer to assist their staff where possible. Looking at what an inherent requirement is, an inherent requirement, not all duties within a role would constitute an inherent requirement, and inherent requirements are specific. So within each job there may be an inherent requirement within that. And it's the responsibility of an employer to clearly outline what an inherent requirement is. And an example may be the ability to perform the essential task to the required quality, the ability to work effectively with other team members or other associations the organisation's worked with, and the ability to work safely. Now, to determine what constitutes an inherent requirement, some roles, it may be that by conducting a workplace duties assessment, that will determine the functional capacity required for each task within the role, and then you can, from that assists in determining which of those duties are actually inherent and an essential part of the job and what's actually required to do that. So we're going to take another attendee poll here and just looking, if an office-based worker suffers from chronic lower back pain, which resulted in them having a limited tolerance to sitting, from the following options, would you conduct a workplace assessment to determine any equipment that may assist the worker, such as a sit and stand workstation? Review the job requirements and provide additional training if required to increase task variation? Recommend the worker seek medical advice? 4, gently move the worker on? Or 5, 1, 2 and 3 as appropriate. So again, in your question panel, if you can just nominate which of those options you think would be most appropriate in the situation where a staff member whose role is largely desk-based is unable to tolerate a long period of sitting. So I'll just give you a minute to provide your answers, and Stephanie will collate these for us.
Okay, so it's looking like, I guess, that the majority of people are answering 5, 1, 2 and 3 as appropriate. A few have responded number 4, gently move the worker on, and also number 3, recommend the worker seek medical advice.
Yeah, great. Thanks, Stephanie. Yeah, and really options 1, 2 and 3, all of those could be taken into consideration, and depending on the severity and what medical advice you may already have, you know, we want to make sure that that's taken into consideration, but definitely looking at where we can make alterations to the workstation setup, and looking at if we can increase task variation, or looking at how we might be able to incorporate some standing work tasks into the role, and getting a little bit creative with what we can do within that office environment as well. So might be looking at things like having standing meetings or, like we said, with that sit-stand workstation or a communal standing workstation. So there's just a little bit more variety and potentially reducing the amount of time where that worker needs to sit down for long periods.
So looking at our next poll, if you're looking at an injured worker who's 47 years old, they work in the hospitality industry, they've been certified fit to work at a reduced capacity, which includes 5 kilogram weight limit and no working above shoulder height. These restrictions will be in place for 6 to 12 weeks. So would you, 1, assess the tasks being performed and enable the worker to perform only duties within the medical restrictions? 2, assess alternative duties, cross-train the worker to perform duties within the medical restrictions. 3, enforce the worker to perform all duties regardless of the restrictions. Or 4, gently move the worker on. And I think, and 5 is 1 and 2. Sorry, it's not showing on my screen. So you've got the options of 1 through to 5. So again, if you just put your answers in the question panel. And as we're doing these attendee polls, if it does initiate a question, then by all means add any questions that you may have, and it may relate to this poll in particular, or it may just be that a thought has come up that you'd like us to address if possible.
Okay, in terms of the responses there, 5 and 4 seem to be the main responses. 1 has also showed up as a response a couple of times.
Okay, excellent. Thanks, Stephanie. And so we'll just talk through some of the response options. So if we look at assessing the task being performed and enable the worker to perform only duties within the medical restrictions, that really ensures that we're allowing the worker to work within their medical capacity that they've got at the moment, and that's absolutely something that we could take into consideration. Also assessing our alternative duties and cross-training the worker to perform duties within those restrictions as well. There's a potential for benefit to both the injured worker and then the employer in that instance as well. So looking at how we can upskill them, potentially getting them to work in a different area of the business as well. So it might be more in an administrative capacity if they're taking bookings, greeting people when they come in, those types of things. If we look at option number 3, enforcing the worker to perform all duties regardless of the restrictions, we know we've got that medical advice in place then, so that's not going to be appropriate. And then looking at gently moving the worker on, we potentially would want to look at options 1 and 2 to see if to look at how we can retain their capacity and their skills within the organisation as well, and especially where we're seeing that these restrictions that we've got in place are anticipated for a 6 to 12 week period as well, but looking at the options which are beneficial for both the worker and the employer.
And so the final poll for the webinar today is looking if I had a 52-year-old truck driver who's experienced an undiagnosed neck pain, which is limiting the neck rotation. Again, would you 1, conduct a work duties assessment, 2, conduct an assessment of the truck, 3, recommend the worker seek medical advice, 4, gently move the worker on, or 5, 1, 2 and 3 may be appropriate. So again, just putting your answers into the question panel. And as well as the answers, again, it may be that you actually have a question at this point. So that option's there as well.
Okay, so the main probably response again is number 5, 1, 2 and 3. Number 4 again has showed up, gently move the worker on, and also number 3, recommend the worker seek medical advice.
Great, thanks Stephanie. And again, just talking through some of the options there that we could potentially select. Given that we've got undiagnosed neck pain, I think number 3 is quite a high priority. So getting some medical advice so we've got a better understanding of the condition, and if we do need to put some restrictions in place to ensure that the worker can work safely within the organisation. Jumping up to number 1, conducting a work duties assessment. There could be quite a lot of value in that, in actually identifying what some of the physical demands are associated with that role and really looking at what those inherent requirements of the job are as well. And then a little bit more specifically, conducting an assessment of the truck. There could be some really easy options for improvement there, so that might include things like better positioning of the mirrors, which would then reduce the degree of neck rotation. So small strategies like that may be able to assist, but we would encourage that the focus to be on those first 3 options there, so getting some more medical advice and then looking at if we can make some alterations to the work environment as well.
Just in relation to point number 3, a comment has come through saying need diagnosis before progressing to 1 and 3.
Yeah, absolutely. That's a really great point. So then we've got a better understanding of where the worker is at from a medical point of view, and then once we've got some information around their restrictions and their capacity, we could then go and have a look at the work environment and making sure that we're marrying the 2 up.
Mm-hmm. Which probably goes on to the question that's come through. Should you also do an assessment of the way in which the driver undertakes his duties?
Yeah, absolutely. Yeah, and really, so not just looking at the environment, but also looking at their behaviour and techniques and how they're moving, and seeing if they can be provided with some advice to reduce any potential strain or factors that are going to aggravate the neck pain.
Just one other question. Are there free work duties assessment templates available?
Not that I'm aware of that are free. We quite often provide organisations with assistance to do so, but I'm not aware that there's a free template that can be accessed at all. Any other questions or comments?
No, nothing at this stage.
Okay, thank you. Okay, and so just moving on to our last slide, it's just a little bit of a summary and highlight some of the ways that you can prepare and manage an ageing workforce. So be prepared by considering options such as training initiatives, and when we talk about training initiatives, it really applies to all levels. So if we take into consideration managers, ensuring that they have the skills required for managing work teams with different age groups. Also looking at our employees and employers, so we've got some that are a shared opportunity, so looking at opportunities to cross-skill a worker and ways that we can upskill a worker as part of their career progression, and also career planning on a medium to long-term basis as well. And these factors can help us to promote the retention of older workers, and it's really important for those in more physically demanding roles as well. And it's really that shared responsibility of employees and employers to keep a worker still current. We can also look at, from an employer perspective, adopting and promoting health and wellbeing programs throughout the organisation. So potentially looking at some prevention strategies, but also those that support the ageing workforce. And then really keeping that continual focus for employers on our work health and safety prevention strategies. And this can really be highlighted when we're looking at our manual tasks as well. And again, we keep that focus on the prevention side of things and working through our hierarchy of controls, so seeing if there's a way that we can eliminate some of our more hazardous manual tasks or incorporate some engineering controls for people to perhaps reduce the amount of force that they're required to handle, and looking at reducing repetitiveness or the awkwardness of their work tasks, and then other lower order controls such as providing manual handling training. And this may assist to reduce the incidence of musculoskeletal disorders, which may be accumulative or degenerative over time as well. Our next point, looking at flexible work arrangements. This provides us with an opportunity to promote a balance between work and personal responsibilities. So some options here may be looking at part-time working arrangements or perhaps work from home opportunities as well. Consideration of making additional annual leave time periods available to reduce the amount of time that people are potentially at work, and also potentially looking at phased retirement through reduced work hours over a period of time as well.
And another option is just maximising that expertise and the value that older workers have developed throughout their career. And that may be, in some instances, is providing supervisory positions for the older worker in an area of their expertise. And as Kirby was mentioning about the prevention strategies, it's looking at adapting the duties to suit the older worker so that they are able to stay within the workplace and share their value with their co-workers, and that may be by using different equipment and reducing the physical tasks that are required of them. And rotation of tasks can be beneficial as well, so enabling people to reduce any physically demanding jobs with less physically demanding jobs, which again will just enable older workers to stay potentially in the workforce for longer. And also bearing in mind at the recruitment phase to actually recruit on a basis of merit, and this can assist with the diversity of the workforce. And so for some roles it can be really appropriate to recognise the relevant experience of an older worker who may bring a lot of expertise into your workforce, but they, in some instances they may not have the formal qualifications. So as an employer, where it's available, just recognising that it's both qualificational experience and that time in the job and the experience that someone can bring. And then within that recruitment, have a clear plan for the career progression so that everybody is aware within your organisation of what your strategy is moving forward to enable options that are available for people as they are getting older, so they know they have that security within your organisation and can stay with you and then be really beneficial to the company over time because they know that progression is there for them. So at this point we'd like to thank you for participating and for being part of the webinar today, and would be a great time for, if any questions have come up throughout the period of the webinar, if you could put those into your question panel. We will be available for a minute or so more to answer any questions that have come up.
Okay, one question that has come through, Kirby and Ruth, as an employer, do you have any other suggestions on how we can prepare both the company and our employees for this issue?
Yep, thank you, Stephanie. So other suggestions that we could potentially look at may include things like a vocational assessment and vocational counselling as well, offering that to an employee, and that may apply if the employee has a reduced level of capacity and is unable to perform some of the physical demands. And what a vocational assessment looks at is a person's previous employment background, and skills that they already have, but also their personal interests, and then it typically takes into consideration any physical reduction in capacity that they've got, and then looking at what some other potential options for employment are. And then looking at working with a provider that can provide a worker specific vocational counselling, so looking at how we could move a worker into a position that we may have identified through a vocational assessment.
Okay, one question that's come through, and you might be able to provide some clarification. It says, are there any initiatives to encourage older workers which are visual within a workplace? So if that question could probably be typed in again, just a little bit of clarification.
Thank you.
A comment, it's important to follow up a worker if they mention or report they are feeling some pain. Some minor injuries can easily develop and require medical intervention.
Yeah, and so is the question more relating to what to do if a worker is reporting pain early on?
I'm not sure.
Yeah, if there are any reports of pain or discomfort, absolutely that's something that we would want to be reviewing early on, so we could put some prevention or management strategies into place. But I'm just not sure about the visual comment in the first question.
Further comment, yes, what seems to be a minor injury should be checked.
Yeah, absolutely, and I guess that just allows to ensure that the worker can perform all aspects of their job safely.
Another question that's come through is my employer my employer thinks that I'm too old and I'm worried that they will let me go. Can they?
Well, looking at that, in a typical situation, no, you normally, and this is not meant as any legal advice, it would just be from the reading that I've done at this point, they can't let you go just because you are too old, but it would be more looking at what are the inherent requirements of the job. So if you're able to perform all your duties within your role, then that should satisfy an employer to keep you on as an employee. So it's about being able and performing the roles that are within your duties within that role.
Thank you. Thanks, Ruth. Again, if anyone has any questions, please do send them in. Question: how do you lead an older worker to the realisation that they are no longer able to fulfil the inherent requirements?
Depending on the industry that you're in, if it's a really physical industry, one of the ways of working with people is to do something like a work duties assessment to determine what functional requirements there are for the role, and then to work with the employee to see if they're able to perform those duties. But if you find that they're not able to perform all the duties, then it may be looking at cross-training to see what other jobs are available within your organisation so that they can then perform duties that are within their physical capacity.
Okay. Just further in response to the visual question, some older workers don't feel valued if employers don't openly encourage workers to work longer. A few responses today mentioned move a worker on by visual. It is meant, how can an employer let you know you are valued and needed other than discussing on an individual basis, like maybe just displaying posters?
Yeah, no, that's a really good comment and question. I guess just taking that holistic approach as well, so right across the organisation, perhaps focusing on the value of all employees and different strengths that can be brought to an organisation.
Okay, so another question, what support as an employer can I give my employees?
One of the things that you could do as an employer is having a really clear progression plan so that people are aware of what options there are for them so that they know in advance that the process that the organisation has available to them. And then also, when Kirby was mentioning before, is vocational counselling and giving options for vocational assessments, to look at what options there are for you, especially if it's a very manual job, to see what options may be available within the organisation to transfer to. Kirby, did you have?
No, I think that's great.
Okay, and possibly the final question, unless there's anything else that's coming through, what options are available if I only have a few employees?
Some of the options would be looking at the various tasks that you have available and that are required across the business and looking at what can be done to assist the different employees again with cross-skilling so that they have that variety of tasks to move forward with as their career progresses.
Yeah, and I guess really being on the front foot and trying to identify some of those options earlier on, even if it's not presenting as so much of a challenge now, but just being prepared and identifying ways that we can look at really cross-skilling all workers within an organisation.
Okay. It appears no further questions have come through. So I'll move to the next slide. There you go.
Great, thank you. And so this was just if you have any further questions or if you would like any further information, please feel free to contact the IPM Safety Office or have a look at our website as well.
Okay, thank you very much, Kirby and Ruth,
thank you for the opportunity.
for your presentation today. And again, if you have any other questions, the contact details for IPM were there, and I'm sure there are other sort of avenues out there where you can seek information about the the ageing workforce. But please do have a look at other webinars we are running during WorkSafe Month this year, and do hang on the line once the webinar closes to complete the feedback survey. Give us your comments about your webinar experience and this afternoon's presentation. So on behalf of WorkSafe Tasmania and our presenters, thank you for joining us today and have a great rest of the afternoon. Thanks.